It's The Law Show on CL 650. A comprehensive look at everything you need to know about the law. Now, here's Sterling Fox.
How come there's no law? How come there's no law for breaking hearts? For breaking hearts. How come there's no fine to pay when you...
Well, good morning. And welcome to The Law Show here on CIL 650. Sterling Fox with you, joined in studio by Joe Murphy, QC, and Derek Ma from Murphy Batista, LLP, Vancouver Personal Injury Lawyers. Gentlemen, good morning and welcome back.
Thank you for having us here.
Good morning, Sterling. It's delightful to be back.
It's nice to have you back with us, Joe. Tell us a little bit. You are one of the founding partners, along with Mr. Batista of the firm. This goes back to the 80s when all of us have, still nightmares occasionally of 19% interest rates and other delightful things that made putting a new business together more than a bit of a challenge.
Well, yes, it did, Sterling. The firm began very modestly. It was Joe Batista and I and two secretaries. We set up in January 1982. I remember interest rates were 19%. Mm-hmm. Businesses everywhere were closing, so this was a bit of a novelty that a new business, albeit very small, was setting up. We rented space in a Vancouver law firm that had 2 extra offices and 2 extra secretarial bays, and that's where it all began. Our philosophy was not to grow. Our philosophy was just to do a really good job for our clients. But over time, because good people came along and because our client base grew, that we as a firm grew. We're now 17 lawyers, support staff of about 65. We have a large office in Vancouver, downtown Vancouver. We have the floor of one of the big office towers. We have an office in Kelowna.
That's right. You just opened a branch office.
Yes,
yeah.
And we have a resource center right beside GF Strong. So things have changed since 82, and it's not just the interest rates.
That's for sure. And Derek, you're one of the more recent additions to the firm, and you, like many other lawyers at Murphy Batista, spent some time working for, shall we say, the other side across the fence. You were working for another firm that in many cases represented ICBC. So you came to know all of the personal law firms, personal injury firms in Metro Vancouver, and had a chance to really take a good look. And so when you decided to jump the fence, it was to go quite specifically, to Murphy Batista.
No, that's right. So I started out and I was articling and I worked for a couple of years at a firm downtown, a big firm. I call it the Ally McBeal firms, where everyone's in a suit every day, regardless of what you're doing or who you're seeing. And when I decided I wanted to move over and do the plaintiff side of it, this was the only firm I applied to because I thought it, in my opinion, had the best reputation, did the best work.
Now, talk to us a little bit about that, from the enemy perspective, if you will, knowing a firm like Murphy Batista with their litigation history. Is that the reputation? Is that why this firm is so highly regarded? Because they're not afraid to go to court, and they win a lot when they do.
I think that's exactly it, is that there's a very good history with the firm. There's a lot of good trial work that's been done by the firm, a lot of precedent-setting cases. And because of that and the reputation of the firm, it just seemed like the right fit in the place that I wanted to be at.
Oh, good stuff. We're going to talk about soft tissue injuries a lot on the program today. But, Joe Murphy, before we start, I wanted to just get a general, because we're talking already about ICBC with Derek's background, having worked for them in the past. There's a real feel-good campaign underway in British Columbia on the public media these days from ICBC. They're doing, they seem to have a very aggressive campaign underway regarding being willing to settle, being friendly, being consumer-friendly. What's that all about?
Well, Sterling, it's really a very wise business decision on their part, because if a person injured has a lawyer, ICBC ends up paying that injured person more money usually than if they don't have a lawyer. So if a person has a $10,000 claim and they have a lawyer, they should be recovering $10,000.
Right.
If they don't have a lawyer, the adjuster may say to them, well, listen, your claim's worth $4,000. And here's some cases, usually from New Brunswick or Nova Scotia, of similar injuries, and the award was $4,000. And a lot of people accept that. So for ICBC, it makes far more sense to keep someone away from a lawyer who can give them advice on the claim, including what it's worth and when to finish it. and deal directly with them. So very wise business decision on their part.
And it's an interesting campaign because they sure are trying hard to be your best friend.
Oh, yes. Yes.
So let's just take that as a start point here, though, Derek. Assuming that there is a campaign to try and keep us away from lawyers, typically when a person is involved, and let's use a traffic accident involving some degree of seriousness, when a person is involved in an accident and there's some discomfort coming from it, how soon or how quickly should anyone contact a lawyer?
My advice always is call a lawyer as soon as you can, because most lawyers, including our firm, we give a free initial consultation, so there's no cost to you to do that.
Okay, now there's a myth they're very popularly held, and Joe, I'm sure you've talked to hundreds of people in your career who I should have called you. I know I should have called you, but geez, you guys are so expensive. I just couldn't. I thought I couldn't afford you. And Derek's here to go, no, wait a second. There's no charge for the first contact at all. Not everyone knows that, Derek.
No, there's no charge for the first consultation. So what we generally do is I advise people call a lawyer as soon as you can, because there is no harm in doing that. And in our practice, what we'll do is we're very candid with people. If people have come in, the accident's not too bad, it maybe is a little bit too early to hire a lawyer.
Right.
We'll give them information about what they need to look for, what they should be looking at, and how to navigate the process with ICBC, and call us back in 6 months or sooner if something else happens and you're not able to navigate the process, because not everyone does need a lawyer right away.
Sure. And Joe, you've said this many times on these airwaves that if you don't need a lawyer, well, you'll be happy to be the first to tell them you don't need a lawyer. But in the process, you also are quite willing to pass along a few basic tips on navigating through the system to your advantage.
Sterling, there's a number of do's and don'ts that we give people when they phone and when they don't need to hire a lawyer, but we say, okay, here's what you do, here's what you don't do, and if things don't turn out well or if there's problems, call us back.
Okay.
But these are people we think can do it fine on their own. They don't need a lawyer, and we're happy to tell them that.
Okay. Derek, if we're going to talk about soft tissue injuries, and I should also get you to tell us a little bit about your background, because before you became a lawyer and worked for that other company that represented ICBC, you had an entirely different career thing going on that's quite relevant to this morning's conversation. Tell us about that.
Completely different career. So I started out as a physiotherapist, and that was my background before going back and into law school. And I worked as a physiotherapist full-time for about a year, and then about another 3 years part-time all the way through law school. But I worked in private and public practice. So I had a good opportunity to see all sorts of injuries, from the very acute, when people are fresh out of a car accident, into a surgery, in the hospital, they get discharged, and then later on when they're coming to an outpatient clinic, usually a private practice,
right,
and they're getting the physiotherapy 2-3 times a week, or whatever it may be, until the point that they sort of hit a plateau and we've discharged them. So seeing that whole spectrum of injuries like that.
So very comfortable with the general topic of soft tissue injuries because of years of literally hands-on experience.
Yeah, I'm very comfortable talking about soft tissue injuries and what they are, and sort of the myths and what to look out for about soft tissue injuries.
Well, we agreed over coffee before beginning the program this morning that there are a lot of myths surrounding this whole file of soft tissue injuries, and we'll get to some of those in a little bit. But Derek, start us off. We're back at square one here, sir. What is a soft tissue injury?
Soft tissue injury is a very interesting term, because sometimes people come in and they say, my doctor's diagnosed me with a soft tissue injury. I don't know what that means. Mm-hmm. And really, to simplify it, it's anything that's not a bone. So in our body, we certainly have the skeletal system, your femur, your humerus, your wrist bone, all those sort of bones, and anything else on top of that or other than that are soft tissue. So that would include things like muscles, ligaments, and tendons.
Right.
So the difference between a ligament and a tendon is a ligament joins a bone to a bone, and a tendon joins a muscle to a bone.
Okay.
But all those are soft tissues. And what will happen is when you're in a car accident, typically if you get a whiplash claim and your head goes forward and backwards, you're stretching all those tissues there.
Right. Are concussions frequently part of you, because you immediately you see the rear ender and you see the test dummy in the TV commercials with the head flying forward and snapping back, and if there's a headrest, there might be some contact at that point. Are concussions occasional byproducts of soft tissue injuries?
Yeah, absolutely. There used to be a very I think it was in the medical literature, people thought you had to hit your head to have a concussion.
Right.
And that's old news. That's not accepted anymore. And if you ask people who've looked at brains, that the brain, your consistency of brain is about jello. It's a custard-like substance in your head. So it sits there inside your skull, which is like a shoebox. So I tell people, imagine you have jello inside a shoebox. Now shake it. And what happens is the jello will hit the size of the shoebox.
Right.
And that's what gets you a concussion. That can happen in many cases. The term for that's called a contra coup injury. And what that means, it's hit one side, then it's rebounded and hit the other side of the box.
Okay. But, Joe, I think just in terms of simplifying the conversation, concussion is a word that we're all very familiar with, particularly when it relates to sports. But concussion really is another term for a brain injury.
Clearly. That's what it is. It's an injury to the brain. You can call it a concussion. You can call it a mild traumatic brain injury. But really, you're talking about the same thing. The other thing that used to be believed by many people, including many doctors, is that there had to be a loss of consciousness for there to have been a concussion.
Right, okay.
And they now understand that that's clearly not the case, that most people who suffer concussions don't lose consciousness, but they're often momentarily stunned. They may be amnesic. There's a gap in their memory. And in sports, the teams or the management of the teams has now learned that you can't say to someone, "Are you okay?" and they say yes, and you send them back into the game.
Exactly.
You've got to go through a process of assessing whether they really are okay. And quite often, people with brain injuries in sports in the olden days would have a concussion, would play the balance of the game, but then later not remember much of the game after they were injured.
That's true.
The fact that someone's conscious and walking and talking and seems okay doesn't necessarily mean that they are okay.
Right. So, Derek, back to the car accident in which a person has been injured and maybe already been diagnosed by the doctor as having, well, you have a soft tissue injury as a result of this collision you were just in. And they come to you going, well, my doc says I have a soft tissue injury. I have no idea what that means. Do you help people to ascertain exactly what's wrong with them in the absence of the doctor doing that?
Well, I wouldn't diagnose anyone
ever
I
get that,
but certainly we help to educate them of what the doctor is probably trying to explain to them about what's going on with them.
Okay.
And so, part of that process is, if you took an X-ray, you couldn't tell if you have a soft tissue injury or not.
And that's the problem, isn't it?
That's a big problem, because an X-ray will show you if there's a fractured bone, but that's really about it. You're not going to see any soft tissue sprains or anything like that.
But they have other imaging technology now. CT scans, not maybe the best, but MRIs are said to be the best in terms of finding soft tissue problems. Is that a reliable technology?
MRIs, are probably the gold standard right now in terms of what you can see and diagnose. But
even they're not 100%.
They're not 100%. I mean, so for example, in your knee, you've probably heard the ACL ligament,
sure,
which a lot of athletes will tear.
You bet.
If you have an MRI of that, you can see if it's been torn or not. Mm-hmm. But you wouldn't be able with an MRI to see if someone's neck has been stretched, the soft tissues there have been stretched or torn or anything like that. It's just too microscopic at that level still.
So there is a bit of a stigma attached to soft tissue injuries as well. Basically, you're a whiner. You got to just suck it up and get better. Stop it already. We all get bumps and lumps and bruises. Get on with your life, for crying out loud. There's a lot of that out there surrounding the whole soft tissue file, isn't there?
Yeah, and it goes back, I think, Sterling, that point to when should you call a lawyer?
Right.
And I think in my experience talking to my clients, a lot of them have to feel comfortable with when to call a lawyer because of that stigma. They're not ready to pick up that phone and make that phone call yet. And the reality is they're probably better off if they had a broken leg and they're on crutches. And everyone, they're walking down the sidewalk, they give them a wide berth, they can see that you're hurt.
Right.
But if you're just there with a whiplash injury and you're walking down the street, nobody would ever have a clue you're in a car accident.
And Joe, suppose now your doctor says you have some kind of soft tissue injury. Clearly, you've been damaged by this. So then you decide you're still going to be intimidated by the pricey lawyer syndrome, so you're going to go handle this by yourself. So off you go to the ICBC Claim Center, and you sit down against some agent, and you tell that person, my doctor says, as a result of that collision I'm here to deal with you about, I have a soft tissue injury. Is the agent likely to say, prove it?
Well, you have to prove that you have any injury before ICBC will pay you. And one of the things, Sterling, that commonly happens in that first meeting between the person injured and the adjuster is the adjuster wants them to sign authorizations. And the authorizations allow ICBC to collect your medical records going back some years before the accident and your medical records going forward. And the problem is there's commonly confidential information in your medical records.
Sure.
It might be about you. It might be about a family member. And I know people can be very intimidated when they sign the form as they're asked to do. And they now know those records either are or may be in ICBC's hands. And they're really frightened about proceeding for fear that this confidential information will come out.
Oh, okay.
The reality is ICBC is not entitled to have records, medical records, except those that are relevant to the injury and the treatment.
So why do they ask for so much then? Is that standard procedure?
The more ICBC has, the better they see them equipped to handle a claim. But for the person whose medical records are given, and if someone said they want all my medical records over the last 10 years, I'd say, of course, no. If my neck is hurt and you want records on my neck, fine. But
sure.
Everything else, no, that's a real invasion of privacy. And people are not required to sign the authorization. But if in meeting with the adjuster they say, I'm not signing that, then the adjuster begins to get more skeptical of what's going on here.
And we got to take a break. Art's having kittens over there, but we got to deal with this just before we do, Derek, because if ICBC is sort of intimidating you into saying essentially, no, you're not injured, prove it, go ahead, prove it, I dare you, kind of thing, and you're unable to do so, or you're unwilling to relinquish whatever medical information they choose to take, then suddenly you have an attitude problem. You're fudging here. You're
trying to hide something.
You're giving them a problem. So how do you deal with that when you follow Mr. Murphy's advice here and you go, no, I don't think I need to sign that today, thank you. And the person is going to say something to you to make you want to sign that or to feel bad about not signing that. So what do you do?
That's frankly when a lawyer comes into play, because we deal with that all the time and telling ICBC, we will get you the relevant records. We're not going to go back 10 years into our client's past and bring up all the private information that's completely irrelevant to this claim. Just because they've been in a car accident doesn't mean that they lose all their privacy in their life. And so we would deal with that, and we would help them prove their claim at that point.
We need to take a break, and we'll carry on with unraveling all of this and even approaching ICBC. We're talking soft tissue injuries. Our guests in studio from Murphy Batista LLP, Joe Murphy QC, and Derek Ma. I'm Sterling Fox. This is The Law Show on CIL 650 with lots more still to come.
There's more of the show still ahead. This is The Law Show on CIL 650.